morning, and thank you for joining us. As you know, we are just in the first part of our third week in phase 2 of the reopening plan. And I was out and about yesterday in Snohomish and Lake Stevens and around the county. It's good to see many of our small businesses opening up. It's quite clear that a lot of people are taking precautions. I saw face masks on most people, and businesses that I checked into had done a really good job in setting up social distancing measures and masks and sanitation features. So just kudos to everybody. We've got to keep it up, and we certainly want to move forward, but we are seeing some I guess what I would say are troubling trends with the numbers both at the state level and locally, and I know Dr. Spitters is going to address that a little bit more. So really encourage everybody to do all those things we've asked them to do, which is wear face masks in public, and when you're in crowded areas, wash your hands, socially distance, just be mindful that the virus is still out there. It's very contagious, and we want to just keep making progress on that. So good job, but we've got some yellow, I guess I would call them yellow lights in terms of our numbers, and we'll be watching those carefully. And we keep in constant contact with the health district and looking at the test results, and I know we'll be getting those throughout the week on what we've seen, any trends we've seen. The other issue I wanted to mention briefly is, I mentioned last week, I've established an Office of Social Justice in my office. I've got 3 staff members assigned to it, very significant portion of their time. And we're engaging others, the Sheriff's Office, the Prosecuting Attorney's Office, the Public Defender's Office, and others. And that group is meeting as we speak. I've decided they will answer directly to me and my deputy, Eric Parks, who is my right-hand person in all matters of the county. So that office will answer to me, and I'll be very hands-on and participating in their discussions. So currently we are prioritizing the actions that I laid out and that others are engaging others, and we'll be coming up with a prioritized action plan for both short and long-term action. Also, the County Council held a forum on racism and criminal justice reform last night online. It went from 6 p.m. to 10 p.m. A lot of energy and passion behind the issue. I guess I came away with 2 lessons that were clear to me. Is, first of all, we've got a long way to go. There's still quite a bit of denial that we have any issues either in our institutions or in our communities. And the second is, it's quite clear we do have issues of racism both in our institutions and in communities that need to be addressed, but there's a lot of passion and interest by many people to really take action on those and really make some progress. So I'm very hopeful. We see it in Snohomish County, we see it at the state level, national level, and even internationally. So I think there's been an awakening, and very optimistic that we're going to make some really real progress in our county and in our community. So I'm committed to that, and look forward to getting to it. So with that, I will turn it over to Dr. Spitters.
Thank you, Executive Summers, and good morning, everyone. Last Friday, we released our first Snohomish County snapshot. You can see that on the website, and that shows our performance and outcomes related to statewide indicators for COVID control. And so I encourage you to take a look at that. I do want to update you on the matter that Executive Summers mentioned, and that is we had quite a large number of cases reported to the health district yesterday, 75 in total, and that's the largest single day total since 92 cases were reported on April 9, recalling that the peak of the outbreak was in late March, early April. So This is a big number of cases. We're still in the process of notifying all those folks, making sure they're isolated, eliciting their contacts, and then trying to find out where they came from to guide our further control efforts. But needless to say, that certainly is a cautious or a caution signal to us all, and I'll comment a little bit more on that in just a moment. I also want to mention we received reports of a large party that occurred over the last weekend with over 50 attendees. You may recall in phase 2, the largest allowed gathering is 5. And it turns out that one of the guests at that event was symptomatic for COVID, subsequently tested positive. And so now we have over 50 people that the health district are trying to locate and reach out to and advise them about their exposure, get them quarantined, and encourage them to get tested. It doesn't appear that masks or social distancing were implemented at that gathering, so we are indeed assuming that all those folks were potentially exposed. So the team is working on that, and that's, I think, just 2 cautionary tales, one data and the other a story, that we'll continue to do our work to monitor what's going on and try to control and suppress any spread. But I think it does, as Executive Summers mentioned, kind of put a flashing yellow light on our progress in the Safe Start reopening. And you know, we may not be proceeding at maximum velocity toward phase 3, but time will tell in the next few days as we sort through what's going on and also get additional days of data to see if this was just an aberration or is this a trend. So more to come there. But I think as I've mentioned before, this Safe Start paradigm that we're going through, it's not, you know, a one-way street. We've been making progress, but if things don't go well, you know, we can get stalled or we can even end up having to move backward. And toward that end, I want to thank everybody, as Executive Summers mentioned, that for all the effort out there to do physical distancing, to do the hand hygiene, to wear the face coverings in public. But I just want to reiterate that for all folks, that this is really important going forward, especially as we do try to reopen and have more contact in various settings. The risk of transmission goes up, so our defenses against that need to stay up as well. And so just reminders about a few things. In phase 2, social gatherings are limited to 5 people outside your home in a 7-day period. Please maintain that 6-foot physical buffer between you and others. Wear cloth face coverings when out of the home, especially when you're indoors in public places like shopping or other indoor public places, but also when you're outdoors. And even if you're in a recreation setting, if there's a lot of people around and you cannot maintain a sustained gap of 6 feet between you and all others, that's a good time to keep one on again. And remembering that that wearing that face covering is, when I do that, I'm protecting you. And when you do that, you're protecting me. It's about all of us working to protect each other. So even if I'm not worried about me getting sick, I can't make that decision for other people. And so that's really why it's important for us all to contribute and wear those coverings when we're out in public. Obviously, good hand hygiene, frequent hand washing, and then carrying hand sanitizer with you for when you can't access soap and water. And again, if you develop any of those symptoms, sore throat, cough, fever, fatigue, lose your sense of smell, get congestion, anything like that that's not standard for you and is not explained by an existing stable medical diagnosis, please isolate yourself at home and seek testing. We have 5 days of testing this week coming from the health district. All day tomorrow, 9 a.m. to 4 p.m. at McCullum Park. Wednesday, that's today, at McCullum Park, 9 to 4. Tomorrow, 9 to 2 at Snow Isle Libraries Branch in Monroe. Thursday, noon to 7 at McCullum Park. Friday, 9 a.m. to 2 p.m. at Snow Isle Libraries in Snohomish. And then Saturday, again at McCullum Park from 10 a.m. to 2 p.m. In addition to people with symptoms, we encourage asymptomatic people to get tested if they are a close contact to a confirmed case, if they live or work in a place like a shelter or an assisted living facility, group home, if they work in a location, a work location that's had a case, or if they're part of a family or social network that's had a case, as well as people who are first responders, EMS, other work settings with a high risk of exposure, or if you're part of a group that is known to have high rates or poor outcomes, especially many of our racial and ethnic minority groups in the county. And last but not least, people who have required testing for pre-procedure, pre-operative needs for healthcare, or sometimes travel-related requirements. Registration can be accessed for our testing sites at www.snowhd.org/NCOV2019. You can get registered for the drive-through testing at that point. So thank you for listening. I'd like to turn it back over to Executive Summers.
Well, just run down through the questions as we receive them. So the first, regarding masks, what is the current health district policy, and are they mandated to be worn public? If not, do you both support a statewide mandate for wearing masks in public? You want to start with that?
Yeah, certainly. Well, I think my comments just now relay the health district's policy and recommendation that all people wear a face covering when out of the home, in public settings, shopping, what have you. And so that's our strong recommendation for the community. And we think that's a critical part of moving forward and getting through this. We certainly would support and endorse any, there's a question about if there were a statewide mandate, if such occurred, if the governor or the Secretary of Health were to issue such an order or proclamation, something like that, we certainly would support that. I think there's a good body of evidence behind supporting that, and so we'll stay tuned in that respect.
Several questions about the party that you mentioned. What area or community the party was in? How rapidly could the virus spread from that one party? Was the individual symptomatic when they went, or developed it after the party? And just general requests for more information about that.
So we believe we have the ability to contact all of the attendees. So we, in the interest of protecting the privacy of the people who attended, and naming the location or community where it occurred may permit them to be identified, and because of their exposure to COVID, then that becomes protected health information that I would be disclosing to you. So because we don't think at this point public notification of the specific place is needed to achieve our disease control, and I won't tell you where it occurred, but as I said, a large gathering, the individual apparently was symptomatic at the party, and I mentioned that tail less about notification of affected individuals, because as I said, I think we're going to be able to reach all of them. But just a reminder, gatherings like that are one, a bad idea, and two, they're not permitted. And second, if you're not feeling well, don't get together with other people. Stay home and get tested.
There was a follow-up on what do the rising numbers mean for moving to phase 3? And I'll just start a bit that we had begun the process of developing the application to move to phase 3 that we would submit to the state. We know what the metrics are. Locally, the state's been pretty clear on that. So as the numbers come in from last week and this week, we'll be looking to see if we think we are even close to the criteria that the state has set. We'll be discussing that with the state and back and forth between the county and the health district. At the end of the day, I've got to submit that application to the state. And, you know, if we're close, we'll talk about it with the state. If we're not even close, or we're trending in the wrong direction, clearly don't meet the criteria, then we'll have a decision to make about whether we submit or not. But we'll do that in consultation with the health district and look at the numbers through this week. Dr. Spitters, is that pretty?
That's right on. Yeah, I can't add to that.
Okay. So a question for me, you said business is responding well to the precautions. What have you heard about any problems at any businesses in the counties? So I've not received any direct complaints about businesses. We all know about the barbershop in Snohomish from a while back. My opinion really is based on personal observation. As I said, I was out and about yesterday. The two businesses that I went into, small businesses that had opened up under phase 2, had social distancing in place, shields, face masks, limited capacity in a coffee shop that I went into. Just my observations are people are taking it seriously. It's not perfect. You know, if I had to grade everybody, they really an A for effort, probably a B for execution, but certainly trying. There's room for improvement there. In some of the large retail stores that have been open, I think we've all seen it. I think my estimate is probably 60 to 70% of the people are wearing masks. The other 30 are not. Pretty good social distancing. The stores have put up precautions, check stands, and in the waiting lines. So again, some good efforts, room for improvement. And you know, the more we do, the safer we'll be. And we can't be 100% safe, but the more efforts we take, the more precautions, the more we can sort of limit the transition. It's my understanding. So my estimation, only, no hard data on that. And I don't know, doctor, if you get any complaints about particular businesses or not. They certainly don't come to me. They probably more likely come to the health district.
Right, none that have come to my direct attentions. Generally, we're referring complainants to the governor's website, and then the Attorney General's office is following up on those. That's you know, I think there was a nursery somewhere in around or near Snohomish where there patrons had concerns about lack of face mask wearing, and so I know that the AG was following up with that place. That's the only thing I've heard about in the recent days or week or so.
So next question, how have the new case number trends been for the past couple of weeks? Also, as testing has increased, other areas where they're seeing case spikes have also seen higher percentage of positive tests. Where is our county in that regard?
Okay, so in the past week or two, you know, we've really been, as I've mentioned on previous calls, we've really been averaging about 100 cases a week over the past several weeks. So 75 cases in one day is a bit of a load. Now, the question about whether, you know, until we interview all those folks and find out when they first got ill and get their specific date of testing, it's tough to express to you, or much less know, whether, you know, what time course those cases have occurred over. So we need a few days to work through all those and talk to all those folks. And you know, we're not going to be able to do an epi analysis on those any faster than we usually would. Our first step is to reach the people, interview them, and get them isolated and get their contacts isolated. So that's the first order of business. And then we'll see updates routinely on our weekly report about epidemiology of cases over the past couple of weeks, which we do. We always report on the full history of the outbreak and then the more recent couple of weeks. So you and we will be looking at that as that comes out toward the end of the week.
Another question about the application phase 3. Has the county and health district begun preparing application to move to phase 3? I mentioned this earlier. We met last week. The county and health district discussed this and agreed to begin preparing the application. The application obviously is could not ever be complete until we have all the data. In fact, that's a huge part of the application process. So we're just in the third week. As Dr. Spitters has mentioned, we have new test results coming in all the time. So we'll continue to be ready to apply, again, looking at the data as it comes in. Let's see. What about testing in South County? Any plans for that? So far, you're centered in Everett, Snohomish, and northern parts of the county. Dr. Spitters.
Right. I think our testing planning team is looking at that into the future, and you can. I'd have to check our testing calendar, but I know South County is on the radar screen for a site, and fortunately, I would submit also that the McCollum Park is reasonably accessible from South County, but I think we have specific South County plans in mind going forward. I just can't tell you what they are right now.
Okay. What is your assessment on mask wearing in the county? I see very few people masking up at grocery stores here. In fact, fewer and fewer every week. What, if anything, are you doing to really push that message? Again, my assessment, I don't know that we have any data on it, is actually, I saw an uptick in the last week or two. I'm in East County, Sky Valley, so that's where I'm most of the time. But we have had this discussion between the health district and the county at length, whether it's a carrot or a stick approach is better on encouraging people to wear masks, as we know there's a significant part of the population that if they're told to wear a mask, absolutely will not do it. And so we've really encouraged people strongly to use common sense and good judgment. And that, I think, is still in the mode we are in. We've had some discussions. There's a project that's just started up last week that the governor announced, which is encouraging people to get online and tell their story about why they wear their masks. And we can get you the link to that. I didn't think to pull it up this morning, but we're also looking at some public service announcement types to really encourage non-politicians or government officials to encourage their fellow residents to wear masks. It's just the best thing for all of us, our public health, but also our businesses and our economy. So I think we'll continue to encourage people strongly through all the methods and means that we can. Let's see. Shirley, you can tell us whether the party was in the north part of the county, South County. Not telling the public that much leads to increased worry and speculation. Doctor?
Well, we don't want to worry people, but I also don't want to, I suppose I could give a general part of the county, but that's just, I don't see that really helping the effort at all. And certainly if we found that we were unable to reach the people affected, then we would look at making a public notification, just as we would for let's say a hepatitis A at a restaurant. And but if we're able to notify all the affected people directly, I think we have to try to honor people's privacy in that way. And I'm sorry if that's distressing. I would just reassure folks that if you're not hearing from the health district in the next day or two, you weren't exposed.
So there was a question about clarifying on the 75 new cases. Were the 75 new cases all from the last 24 hours? What's the breakdown by age and city?
Yeah, so again, 75 cases reported yesterday. So when they were tested, when they became ill, all that is we're still working through that.
Question for me. I missed last week's Zoom meeting, but would like to hear what type of response you've had to your proposals on policing and social justice reforms from the prosecutor, sheriff, and council. This can wait. But actually, let me briefly say that the response has been pretty positive. not 100%, but I'd say the council has been very supportive. As I mentioned, they had a 4-hour public forum last night via Zoom, and I'd say a vast majority of people are supportive of addressing these issues both in our institutions and in our community. The sheriff has given a positive response with some caveats about concerns about funding for those proposals, and we'll work through those as we go forward and sort of refine those proposals and prioritize them. We know some of these things, such as body cameras that I recommended, do cost money, and we've got to address that issue. But by and large, the response has been really positive. There's some resistance in the community, some people that don't think there's a problem. I already mentioned that, but that is not going to go away anytime soon. We just have to move forward. So, question about our hospitalizations going up with increased case count, and what is the county's current rate of infection per 100,000 residents?
Okay, so the hospitalizations are stable. We've been in the mid-20s to low 30s, you know, with a little bit of up and down. Currently, we're in the high 20s of COVID patients in Snohomish County Hospital, so that's stable. And our last calculated 2-week rate, I believe through yesterday, was 24 per 100,000 per 14-day period. That's up from 21 during the shift back a week, and then the prior 2 weeks was 21. So that's actually our first increase since the top of the curve back at the end of March. So again, just sort of a caution signal to us all, both in terms of how we handle ourselves in public and in gatherings and what we choose to do, and then for the health district and the county as we look at our plans going forward here in the next week or so.
How many people are doing contact tracing and case investigation today? And are you using the National Guard resources that the state has made available?
No, so we are not using the National Guard right now. We're using our own staff, dedicated communicable disease control and epidemiology staff, repurposed staff from other disciplines within the health district. Those folks total up about 30, and then we've got Medical Reserve Corps volunteers and additional folks that we're still in the process of hiring with CARES Act dollars. And so that's still a growing pool. And at the current time, anything that we can't handle in terms of workload, the state health department investigation does. So we're able to cover everything that's coming in, and we're continuing to grow the ranks for the contact investigations.
And a follow-up question about trends. Pierce County is concerned about a rise in the number of cases. So I just wanted to ask, other than the 1 day with 75, are we not seeing a similar alarming trend, or are we not seeing a similar longer term trend?
So, well, I don't know if it's, I think yesterday's number is a little alarming, a little concerning. We definitely need to work through that and then see if that's sustained. Absent yesterday's report, still that figure I just gave of 24 cases per 100,000 per 2 weeks was calculated up through last Saturday. So that predates the 75 cases reported yesterday. So, you know, I'm not sure that's a statistically significant bump up from the 21 during the prior 2-week frame, but it certainly indicates that we're not going down further. And so not an alarming trend, but, you know, certainly, you know, we were kind of bottoming out over the last 3 to 4 weeks, really kind of flat, which is okay. So if going up a little bit merits further attention, we'll just have to see where it goes and take it from there.
Great, thank you. And I've been reminded that the campaign on social media and elsewhere to have people really video and record and put out their reasons for wearing a mask. If you look at Google hashtag wear a mask law. I put the link or the hashtag in the chat box. You'll be taken to their site. It's a nonprofit organization that's been founded really to use technology and social media to get the message out. And there's some other good projects they're working on there. So I really recommend that organization and that movement to you for that. So there you go, restart.us, wear a mask campaign. So the website and the organization is Restart, and the campaign on social media is wear a mask law. So I think that's it.
Thank you. This is Carrie Bray in the Joint Information Center. Thanks again, everyone, for joining us today, and thank you for your questions. We will go ahead and wrap up now, but please do stay tuned for future availabilities.